Welcome back to Chronically Sabrina. In today's video, we're going to talk about a condition called gastroparesis. Gastroparesis means delayed stomach emptying. So a person that has gastroparesis, their stomach does not empty like it is supposed to empty. This can lead to symptoms like nausea, vomiting, constipation, diarrhea, things of that nature. Some people with gastroparesis vomit, some don't. And going about the diagnosis of gastroparesis, the way most people are diagnosed with gastroparesis is a gastro-emptying study. This study is done between 1.5 to 4 hours, depending on the study that is being done in the hospital that it's being performed at. And basically, the patient will eat the food, and then x-rays will be took and see how much has emptied. There's limited treatments for gastroparesis. These treatments include Reglan, which a lot of people don't want to take because it has really bad side effects like tardive dyskinesia, which is a Parkinson's-like disease. There's also domperidone, but it is actually not legalized. It's not FDA approved in the United States. So if a patient is severe enough, they have to actually get it from Canada. There's also some antidepressants that actually help mitigate the symptoms of gastroparesis, like the nausea. Also, there is antiemetics like Zofran or Phenergan. Some people have ports, and some people will actually use IV Phenergan or IV Zofran. It just depends if they have a port for other conditions, other reasons. I want to include how it affects me, because I was diagnosed in 2019 with severe gastroparesis. In my gastro-emptying study, I had the 1.5 hour study done, and I'm pretty sure it was I think it was only 11% was emptied within an 1.5 hours, which is really bad. It takes about 12 hours for my stomach to empty. A normal person's stomach empties within 4 hours usually. So if that tells you the degree of gastroparesis that I have. I also want to note, I do not vomit very frequently. It's just not a problem that I have. It's caused a lot of issues with GI pain. I get really, really bad pains in my stomach. I had to have my gallbladder removed because it wasn't functioning correctly, and so it got removed. I also experienced extreme nausea after eating. And sometimes the nausea is I can bear it without taking Zofran, but a lot of times it's really bad. At this point, I take Zofran almost every single day. I wanted to make this video to make aware of gastroparesis for people who do not know what gastroparesis is. Gastroparesis can be very debilitating depending on the person with the condition. In my case, it's hard to maintain my weight. And with me being a person who has suffered from an eating disorder, it makes it really difficult to actually kind of not slip back in old behaviors. But with that being said, I would like to ask you if you would subscribe if you haven't, like the video, and hit the bell notification so you can be notified when I upload a video.